You don't have to visit a pedicure salon to solve the problem of cracked heels. Today we will tell you about the most effective methods and devices to get rid of this unpleasant defect at home. You will also learn how to identify the hidden causes of cracked heels and how serious they can be. Heels are most often cracked when dry, thickened skin appears along their edges. When we walk, the fat pad under the heel flattens and stretches, putting dynamic pressure on the skin from the inside out. And since dry skin doesn't stretch well, it starts to crack. At first there are small cracks, but later they become deep. They begin to hurt, bleed. Sometimes they get an infection. Heels can crack in healthy people as well. This can happen for several reasons. Standing work, being overweight, wearing open-heeled shoes, flip-flops, sandals, dry indoor air, heel rubbing, and the back of shoes, taking too long hot showers or hot baths, harsh foot soap, cold season. Later we will tell you in which cases heel cracks are a symptom of diseases. Now let's take a look at how you can get rid of this nuisance quickly and effectively. Keratolytic products. You need more than just a foot cream. You need a specialized heel crack remedy. Such a product contains a keratolytic, a substance that dissolves the top dead layer of skin. Cytolytics work about the same way. They reduce the depth of the cracks, creating conditions for healing. In other aspects, however, they differ. The following 4 urea keratolytics are considered to be the most effective. It's very effective. It not only removes dead skin, but also protects it from drying out. Alpha-hydroxy acids reduce inflammation and improve skin texture. Salicylic acid reduces the tendency for skin to thicken and penetrates deep into pores to help remove dirt, oil, and excess sebum. Allantoin forms a protective protein film that prevents the skin from drying out and relieves irritation. Among the auxiliary components, creams from cracked heels are considered the most effective, and Zamiratsa carita, hyaluronic acid, ceramides, jojoba oil, shea butter, glycerin, vitamin E, nicotinamide. Their action is aimed at moisturizing, nourishing the skin, restoring its structure, relieving inflammation, and antibacterial protection. Foot baths. If you have rough and thick skin on your heels, have a home pedicure session. Stir some liquid soap in a basin of warm water and soak your feet for 20 minutes. Then gently rub your heels with a pumice stone or foot file to remove the thick, hard skin. Soak and dry your feet. Apply a thick moisturizer, petroleum jelly, or keratolytic products to your heels. Then put on a pair of thin cotton socks to keep the cream from smearing. This procedure is recommended before going to bed. Do not rub your heels when they are dry. This can cause damage to the skin. Vinegar baths. The procedure is no different from the above, except that instead of a soap solution, the feet are soaked in a solution of vinegar. To do this, mix 2 parts warm water and 1 part vinegar. For example, pour half a liter of vinegar into 1 liter of water. Vinegar is a mild exfoliant and also has antibacterial properties. Vinegar baths can be taken no more than once a week. Moisturizing socks. These soft silicone products are similar to heel sleeves. You can buy them in pharmacies or order them online. Moisturizing socks prevent the skin from drying out and protect it from friction and stress when walking. In addition, some manufacturers coat them from the inside with a therapeutic composition containing oil and vitamin E. These products can be used together with moisturizing cream. Apply it on clean, dry heels and put moisturizing socks on top. If you have cracks not only on your heels but all over the foot, similar moisturizing socks that cover the entire foot will work for you. Medical glue. It is also called liquid dressing or liquid bandage. Newer liquid dressings come in the form of sprays. Although these products are usually used to cover wounds and cuts, they are great for cracked heels. Studies have shown that even the deepest cracks heal in just 5 to 7 days. How to glue a cracked heel. Wash and dry your feet. Gently squeeze the edges of the crack. Apply glue to the top of the crack so that it covers it completely along its entire length. The compound must not get inside the crack. Continue squeezing the edges of the crack until the glue dries. Liquid dressings are waterproof, so you can safely take a shower or bath. The adhesive patch will last 5 to 10 days, after which it will fall off naturally. Honey. This natural product has antibacterial, anti-inflammatory, and wound healing properties. Studies show that honey can help cleanse, moisturize the skin, and heal skin breakdowns. You can use honey as a scrub after soaking your feet in a foot bath, or apply it as a foot mask at night. Coconut oil. Coconut oil reduces inflammation, moisturizes the skin, and promotes healing of cracks. Using coconut oil after a foot bath as a moisturizer is effective both for getting rid of cracks and preventing them from appearing in the future. Pathologic causes of cracked heels. All the above methods are applicable only if the cracks on the heels appeared due to natural causes. If they are caused by disease, however, the treatment of cracked heels should be done under the supervision of a doctor. Cracked heels can develop in the following pathologies. Avitaminosis. Cracked heels can occur with vitamin C and B3 deficiencies that occur with an unbalanced diet. Vitamin E also plays a huge role in the health of the skin. Its deficiency develops in gastrointestinal pathologies. Foot fungus, most often accompanied by itching, burning, and tingling in the feet. Dermatitis is a drying of the skin of the feet accompanied by itching, redness, and flaking. Psoriasis. Red or pink spots covered with silvery scales appear on the legs. The skin of the feet may be itchy and sore. Diabetes mellitus. Diabetics often have nerve damage in their feet, resulting in impaired sweating. In tandem with poor circulation, this leads to dry skin on the feet. Disruption of glucose metabolism impairs fissure healing, then can subsequently lead to deep ulcers. You will be able to detect diabetes mellitus by the following: frequent urination, constant hunger or thirst, tingling in the hands or feet, chronic fatigue. If cracked heels are caused by diabetes, trying to get rid of them without the help of a doctor can lead to non-healing wounds and risk infection in the underlying tissues. Hypothyroidism. Many people with thyroid hypofunction complain of dry, cracked skin on the soles of their feet. If your heel cracks are deep and painful, and your skin is very stiff and thick, it may be a reason to check your thyroid function. Cracked heels in women can be associated with hormonal changes, most commonly during pregnancy, in the third trimester, and post-menopause. In the latter case, doctors may recommend a woman's special ointments for legs with estrogen. Dry, cracked skin is an entry gate for Staphylococcus and Streptococcus. As they penetrate the subcutaneous tissues, they cause swelling and inflammation. The infection can then travel to the lymphatic system, blood, and even the bones, causing dangerous complications. If you are prone to cracked heels, take the following preventive measures. Use orthopedic insoles or silicone heel pads. They will evenly distribute the load on the foot. Wear properly fitting closed-toe shoes with well-fitting backsides. Wear soft cotton socks. Drink plenty of fluids. With dehydration, one of the first things to suffer is the skin. Use a pumice stone after showering a few times a week to prevent your skin from thickening. If your feet get cold at night, go to bed in socks. Wear waterproof shoes with a warm lining in winter. If you are overweight, you should lose weight. Reducing your body weight will reduce the pressure on the skin of your heels. If your own attempts to get rid of cracked heels have failed, see a podologist. A healthcare provider may perform surgery to cut or scrape away dead skin on the heels, for prescribing a prescription cream with a higher concentration of keratolytic.
This content is for informational and educational purposes only. Consult with a doctor or healthcare professional before following any recommendations provided in this video. Tell us about your experience in the comments and subscribe to our channel.